think everybody should be in therapy. Life is hard. We have so many conflicting messages out there. And we're working with a prehistoric reptilian brain that has not updated to today's world. It's overwhelmed quite often. And it's not your fault. It's just how life is these days.
Welcome to the Dangerous Women podcast, where the intersection of fierceness and femininity fuels empowerment. Our goal is to provide women with insights to unleash their power. Grounded in the 7 principles of self-confidence, we guide women to embrace their duality, delicate as a flower, yet powerful as a bomb. I'm your host, Colleen Conlon, inviting you to join me as we explore topics on health and wellness, empowering you to embody the essence of your dangerous woman. We're back with Christie Ashbeck, and I'm so excited that we get to have this conversation with her today because I remember there have been several times that I have reached out to find support from a therapist. And a lot of the times I have reached out, I felt like, I don't know that this is the person I want to stick with. I don't know if this is the experience that makes the most sense for me. And once I found my current therapist, it was because I was talking to a client who happened to be a therapist. And I had shared with her a number of times where I was looking for help, but it seemed like I wasn't finding the right person. And she helped to navigate me to find a number of different key terms to search for in seeking out a therapist that was appropriate for me. And I don't know where I would be if I didn't find that person who had the skill set to help me. And today, Christy is going to help you understand the different components of what you need to be looking for in a therapist that is well suited to help you. So, Christy, this is like such a big topic for us to discuss. I don't even know where the best place to necessarily jump in is. So we might be a little bit all over the place, but can you just start off and give us your perspective on people trying to find therapists who maybe have never found one in the first place, kind of some, big components, and then we'll dive in deeper based off of what it is you have to say on this initial response.
Okay, sure. Yeah, so the deal about finding a mental health therapist is that we don't have the common terms to specialize what type of mental health therapist we want. As in, if you're looking for a physician who specializes in orthopedic surgery, you would not go to a gastroenterologist or a urologist. You would find somebody specifically to work with that, ailment. So with mental health, we find a lot of people experiencing anxiety, depression, and they go to a broad spectrum of therapists and don't really know which one to pick because they don't really know why they have anxiety or depression, which makes sense. What usually happens with those people is that they'll go to a facility and they will fill out an intake form and they'll be assigned a therapist, and they'll stay with that therapist and try to get some relief for their ailments. They might notice they're not getting as much as they wanted or thought that they would, but then they're not sure if it's their fault, their problem, their misunderstanding of the process, or if it's a therapist just not a good fit. So there are specific terms depending on what type of therapy you're looking for that would guide you in the right direction. I think knowing we have a more broader awareness of complex trauma and trauma in our society now and how that shows up as anxiety and depression. So if somebody's looking for something specifically in that component of having extreme triggers, emotional reactions, you'd probably want to find somebody who knows how to get to the root of that, which would be a trauma-informed therapist.
And I've noticed that there's a bunch of different people you can connect with when you go to something like Psychology Today. What is the difference between working with a psychologist or a licensed counselor or a social worker, all of these different terms. I remember when I was doing a search for the latest person that I'm working with, I saw all of these different terms and I was like, is one better than the other? Is there one that I should be working with or one that I shouldn't be working with? What are the different types of qualifications therapists have, and what should we be looking for?
Yeah, so a psychiatrist or psychologist is a mental health professional. They have a doctorate degree. They can prescribe medication. Underneath that, we have the therapists in the master's degree section, and those are our licensed clinical social workers, our licensed marriage and family therapists. We have licensed substance abuse counselors, and then we have licensed professional counselors, which is the one that kind of does all of the below mentioned things, such as the social work aspect, the abuse counseling aspect, and the marriage and family aspect. They just don't specialize in one specifically.
Is there a pro to working with somebody who is specialized in one particular area?
Yeah. So definitely, if you are having a substance abuse issue, they would be recommended to go see somebody who specializes in substance abuse, and that would be a licensed substance abuse counselor, an LSAC. You could go to an LPC who could help you, with some urges and cravings. But if you're in the critical state of needing to be, extensive care and bringing maybe some family work around the substance abuse problem, the substance abuse counselors do have specialized training in their master's program about that.
Okay. And then in regards to going to somebody for a specific issue, whether it be I need help because of PTSD, because of substance abuse, because of what's going on in a relationship, what are all of the different like big picture umbrella categories as to why somebody would be seeking a therapist? And I remember, so I was searching for somebody who had I was searching for somebody who could support PTSD, but I didn't think that I had PTSD. But the client of mine was like, no, you have PTSD. You need to find somebody who can help you with this component.
Yeah.
In all of these different topics, is it possible that maybe people don't realize they have something like me and PTSD, for example?
Yeah, absolutely. I have clients who come in because are struggling with anxiety and sometimes depression. And as we talk about where this comes from, we start realizing this is not just a symptom that they're exhibiting. This is a symptom of trauma. They have been exposed to something where their system has been overwhelmed, and they're left with these symptoms that are a result of that, a direct result of that. So you need to have a therapist that knows how to go backtrack into the history and find out where that event occurred that was overwhelming, that left these responses still kind of looping around in the system.
And is every therapist, regardless of, being a psychiatrist, psychologist, being a counselor, being a social worker, all these things that you already spoke about, would each person actually be able to go back to figuring out where the trauma initially came from?
So I would say their psychiatrists mostly deal in medication management. I'm not going to say that there aren't some that have advanced training in trauma that can do some trauma work if they want to. They usually don't have the time. Their sessions are much shorter. They don't do the 1 hour long sessions. They just do med management and then they move on. And they collaborate with another therapist that would do an hour long session. Psychologists, same. They probably spend some more time with the client getting to know them. They're not just more med management as a psychiatrist would be. Underneath that, we have the master's level clinicians. You've got the ones we mentioned before, the social workers, you've got the marriage and family therapists, you have all of those. And each of those can be trauma informed. They can go to the EMDR training. They can go to somatic experiencing training. They can go to IFS, internal family systems training. So they can learn how to work with trauma.
All of those things that you just mentioned, what are those?
So EMDR stands for eye movement desensitization reprocessing. So with trauma, it's important to know that trauma lives in your body and you often don't have a cognitive awareness, like a memory of, oh, where that came from, but you experience the symptoms in your body. So EMDR, SE, somatic experiencing, internal family systems, all of those interventions are more of a body based approach where we work with the feelings and the emotions first and not so much talking in the head about what happened and what I remember. It's more listening to the intuitive guide of the nervous system and following that to release the trauma that's been trapped in the body. It's a different type of an approach.
Are those things that all of these different mental health practitioners would do with a client? I know you already said that a psychiatrist is really just about prescribing medications and working in collaboration with another practitioner. But for that master levels category you were talking about, is this stuff that all of those practitioners might be able to use on a client?
If they have the training, they do. But this is training that comes after their master's program. And this is where it gets important for the client to know somehow what type of clinician they're looking for. Because a master's level clinician right out of school who just passed their exam, most generally, they're not going to have advanced training in this trauma work that we're talking about, because this training, it could take years to be able to achieve certification level. And they don't allow people who aren't individually licensed to take the trainings. So individually, independently licensed is a category that is also good to know. Right out of school, you're going to have associate counselors, associate level counselors who need to work for a minimum of 2 years under supervision before they can be let loose independently with a client on their own. So we would say they would have less experience than a individually licensed therapist.
And if I was somebody who was, just searching somebody out online, or maybe I was using an app to find somebody, is it possible that I would get put with an associate, somebody who's just getting started?
Absolutely. Yes. As I was an associate once, as well as an intern once, I worked at facilities and I would just be assigned clients and I would not really have, the training needed to work with these clients. The idea was just to get me the experience of sitting in front of these people and then figuring out within the 2-year time frame, working towards my independent licensure, which category I wanted to specialize in. But yeah, so if you go online, if you go to a facility and you just ask for a therapist, there's a good chance you're going to get put in the caseload of whoever it is that's needing clients. And it may not be a good fit for you.
That just gives me like a feeling. But at the same time, I understand, any profession, when you step in, there's always going to be a beginner. You have to be a beginner before you can become a master at something. But at the same time, I would imagine if you're somebody who has a lot to unpack, or if you're in a really rigid state, you might not want to be with a person who is green in this world.
And that's exactly what, as a client, it's kind of the client's responsibility to make sure they're getting somebody who has that experience. Because if they don't mention that, they're not going to get someone that has that experience. For instance, I was an LAC, I was an associate. I had to work 2 years under supervision in a broad category so I could get the experience of what that was like. I was placed with couples, hostile couples that I didn't know how to deal with. And I sat with them because I had to, right? And was getting my hours accumulated, my time built up. I really didn't know how to work with these people. I didn't have any specific training on couples, and it was undoubtedly outside of my scope. But at the same time, how the facility covers that is that I was under supervision. And so once a week, I would have an hour with my supervisor and I would ask them what I should do with these people. And they would give me an idea. And I'd be like, okay, I'll try it. And then it may not work, or it will work. In the same thing, I was stuck as an LAC with a lot of like children. I love children. I don't specifically want to work with children, but I needed to have that experience of what it was like to work with children and adolescents. I was not specialized in working with these children. The clients didn't know that. They just assumed that from what they filled out on the intake, they would be placed with a therapist that was specialized in working with children. It was a bit of a mismatch.
So, how does a client go through the list of things to look for in a therapist to find the right match for them?
So as far as working with associate therapists, there are some that are really good. They just haven't been able to have the supervision needed to obtain independent licensure for some reason or another. But anything, with an A in the credentials, like LAC would be associate counselor. Substance abuse would be a LISAC, LISAC, licensed, I'm sorry, LSAC, licensed substance associate counselor. You'd have LMFT, which is licensed marriage family. You'd have an A in there.
Mm.
Licensed associate marriage family therapist. Same with social workers. There's an A in the credentials.
So long as there's not an A, we know this isn't your first rodeo.
That's right. You're exactly right. Yeah.
Okay. And then beyond that point, what are the different things that could be on a practitioner's bio to be like, oh, this is what I want? Like, for example, I knew I wanted to find somebody who had PTSD, trauma informed. I wanted somebody who was familiar with family and marriage counseling. What are the other things that might be on somebody's bio to consider when finding somebody that can help you?
Yeah. So specifically, if you're looking for trauma informed, you would look for EMDR is very research based. EMDR is very popular trauma based therapy and is proven to be effective across the board for PTSD and complex trauma. So EMDR would be a good one to look for. There's also IFS, which is internal family systems, as that's evidence based as well. A lot of history with that one as being effective. And somatic experiencing, that would be SE. There are some other ones, but I would look for a bio that definitely said trauma informed and some specific type of training that they've been through, because the training resulting in a certification of some type just shows that they have met the standards for that, credential, so that they can promote that and carry that. And then you have people who are looking for, marriage and family therapists. And so some of the things for that you would look for, like EFT is emotionally focused therapy, which is a very well-known intervention for couples. There's Gottman method, which is proven to be effective as well. There's relational life therapy, which is RLT. So it depends on what you're looking for. Most people come to therapy because of trauma. They may not know it, but that's what they're coming for.
It's so interesting because as you're saying these different things, I'm aware of EMDR. It's something that I have been doing. And I had no idea that this kind of stuff goes on in therapy. My initial thought was, oh, yeah, I go to a therapist and I talk to them. And that's all it is. It's talk therapy. All of these things that you're talking about are different than just having a conversation and telling your therapist, life is kind of hard right now. Can you help me do something about it?
Yeah, absolutely. This is why it's so critical to make sure you have the right fit in your therapist. Because, I mean, truthfully, there are some people that I even have to this day, and they're great clients. They don't really want to do the therapy thing, though. They just want somebody to sit and visit with, just 1 hour a week, who validates and seems to understand, their perspective. And they feel a little bit better when they get done with that.
Mm.
There are some therapists that would specialize in that. They don't really know the interventions. They just want to be there to support and validate, and that's fine. And then there are the therapists that really want to get in there and get work done and change lives and make big differences, changing the family dynamics, changing the belief systems, the patterns and cycles that are destructive, just, identifying, exploring, and altering them. You need to find a therapist that really, is giving you what you want.
Can you give us maybe 3 different examples of what could be happening if you're working with a therapist who is specializing in one of these techniques like you just mentioned? I think it would be really cool if you could give a brief description of what an EMDR session looks like with a client.
So for EMDR, this would be the people that have maybe some random panic attacks that they're not quite sure where they're coming from, but they're starting to be increasingly, debilitating. And they can't fight their way through it by telling themselves, everything's fine, I'm okay. They're body basically isn't really listening to that. So with EMDR, which is a body-based approach, you would come in to an EMDR therapist and you would not talk so much. In fact, you wouldn't talk much at all. You would more watch and observe thoughts, emotions, and feelings go through your body when you envision a target memory of a disturbing event. So it's really based on what you're noticing in your body, what emotions coming up for you now, what's changing, instead of a conversation of, problem solving or well, have you considered this? And maybe there's some insight you should think about over here. It's a completely different approach.
And I believe, and I would love if you could correct me if I'm saying this incorrectly, going through the process of EMDR, it's almost like rewiring the brain. I don't know if I read this somewhere. I don't know if I was told this or if I'm making it up in my head, but it's kind of like a modern day lobotomy, pain free, like no physical pain, but it's almost as if you're able to remember these past experiences in a way where you're able to not feel as triggered by them.
You're right. And that's why you don't experience the panic attacks and the high level of anxiety, is because you desensitize yourself. EMDR stands for eye movement desensitization reprocessing. Over time, you end up desensitizing the stimuli that you have collected in your body, so you're no longer that reactive to it. That means that your amygdala in your brain isn't sending out false alarm messages that there's danger. It kind of downregulates that for you.
What are two other examples of therapeutic techniques to be aware of?
Yeah. So one I haven't talked about, which is a very popular and a core therapy, is DBT, dialectical behavioral therapy. Marsha Linehan created it. She struggled with borderline personality disorder and was in and out of psychiatric hospitals for self-harm, suicide ideation, explosive, intense emotions for years. So DBT is a way of looking at two things at the same time, dialectically. So prior to DBT, we had CBT, which is cognitive behavioral therapy. Cognitive behavioral therapy had a lot to do with, well, if you're thinking this way, change it and think about this way instead. Therefore, you'll feel better. Okay, so it's don't do this instead. Don't believe in that. Think about this instead. And then DBT is, well, you can think that way and accept that way and also be aware that this kind of works over here too. So you kind of have a balance of acceptance instead of an all or nothing one way, to think about the problem. DBT is where you really brought in, I guess, therapy really brought in the ability to use that prefrontal cortex that we have to observe our emotions and consider our thoughts and decide what we want to do with them instead of just reacting and then trying to control our behavior. It's more like it gave us the freedom to observe and be curious about what is coming up in us instead of believing it to be true and that we have to do something right now.
And then how would that session look between practitioner and client?
Yeah, so DBT has 4 modules. It starts with mindfulness, a lot of psychoeducation about how to be mindful of the present moment, how to use your wise mind, they call it, so that you can be observing things, not reacting to things. The second module is emotion regulation, about what you do when you notice your emotions going up, how to bring yourself back down into a healthy, regulated state. And then the third model is distress tolerance, things you do, crisis survival skills. When you notice that you have lost your cool, you are overwhelmed, full-blown, angry rage or emotion, how you get through that without hurting yourself or somebody else. And then the last module is interpersonal effectiveness skills, where you learn how to communicate with other people, set boundaries, use your voice, speak your truth assertively, not aggressively. So DBT is pretty extensive, and it seems like it falls into almost all of the interventions that we have that followed.
It sounds like from what you're saying, it's like this isn't something that we're just going to be able to go in for one session,
no,
do this practice.
Yeah,
So,
absolutely.
Okay. So
yeah.
If I'm somebody who is doing this for the first time, am I session number 1, I'm coming in and we're just going to do some exercises around being mindful, staying in the wise adult, and then, having conversations around different things going on? Or Is it more similar to EMDR where we're going to feel what's going on in the body and use some different gadgets to help us with that process?
Right. Yeah. So DBT and EMDR are very different. DBT is more of your talk therapy,
Okay.
of more of noticing and then discussing, naming what's going on, bringing validation and awareness to thoughts and emotions, and a lot of skills. There are so many skills. DBT skills groups are very popular, where you go in, up to 3 times a week and learn DBT skills, because it's pretty extensive. EMDR is more of, you're focusing on a target memory, and we are going to just let the nervous system, let the brain run through whatever it associates with that target image, and then we're going to pull that up. It comes up from the bottom of it towards your awareness through by your emotions and sensations in your body. So I guess that's a good point, is that DBT, CBT, they're what we call top-down approaches, where we literally talk about it and try to, soothe our nervous system down here. The bottom-up approaches are the trauma-based approaches, where you're working with the emotions and the sensations and the memories down here to see what awareness comes back up this way.
Kettlebell Catalyst, the exercise guide for women to build strength, lean muscle, and self-confidence to overcoming limiting beliefs, is a book I wrote for women to be empowered to get started with kettlebells. In this book, not only will you learn the 101 details of hardstyle kettlebell technique, but you will also meet lots of women who were brave enough to try using kettlebells and hear how they transformed both physically and mentally. To buy your copy, visit Amazon or Barnes & Noble today. I find this so interesting. I would have no idea what all this stuff is, having not initially finding somebody who wasn't just, a quick Google search or quick search on, BetterHelp, find me somebody ASAP. Not to speak negatively of anything like that. I think if you are somebody who is trying to find help, great, kudos to you. And anything that's out there that, does have a good purpose to help other people is wonderful, but it might not always match up the way you're hoping it's going to. Is there another approach that's different than those two techniques that you'd like to share with us?
Absolutely. So RLT is relational life therapy. It's one of the newer modalities on the block, and we're currently doing research and trying to get this evidence-based approved as well. RLT it's primarily a relationship therapy for couples, for relationships with other people. We're social creatures. We need to be connected. And if we're not connected, it can lead to a bunch of dire symptoms. But RLT, we do a lot of talking, assessing, back and forth between, the partners in the relationship. There's a lot of skills that are taught. And there's also the stuff that goes underground of, where did you learn this experience? And a lot of going back into family of origin and uncovering what EMDR does, of where that neural network in your brain got established and how it's no longer serving you, especially in the relationship you're in. So RLT, relational life therapy, is one that is a different approach.
And, because you bring up, you just said, and I know we had a conversation about this after one of our other podcast recordings, family of origin and inner child work. I know it's like really hot on social media for people to talk about like shadow work and light work. Does everybody do inner child healing? Is it important for a specific type of person looking for therapy to be doing inner child work? Is that something that somebody, coming to therapy for a substance abuse issue would be seeking out, as well as somebody who's coming due to sexual assault? Who benefits from inner child healing work, and who can actually administer that as the practitioner?
Yeah. So inner child got really popular, the concept, back in the early 70s. And it's this theory that there's literally a part of us that is inside that still today is very young and will pretty much take over the whole experience of the person and start acting as if that child was here again in the here and now. So the inner child work is getting back into those younger years through some experiential exercises, having conversations with that younger part of yourself, seeing what that younger part of yourself experienced, and integrating that younger part of yourself in with the rest of your adult life so that it isn't so reactive. As far as who does inner child work, PM Melody, she has another intervention called PIT, post-induction therapy. She brought inner child work on the scene with John Bradshaw and Charles Whitfield and some others as well. But she wrote a book called Facing Codependence that really got into this concept of having this, inner child that she called the wounded child and then the adapted child into conscious awareness and working with that specifically to treat the symptoms that were contributing to addiction, trauma responses, anything that was interfering with the client's life. And then RLT is based off of PM Melody's work. So there as well.
Does everybody benefit from doing inner child work? Or is that a broad statement?
Yeah, no, I think so. I think the inner child work is you got to figure out your history and how you created these belief systems so that you can change your mind and do something different. So that the narrative becomes, what is wrong with me? It changes into knowing what I know about what I went through. I can totally see why I would react like that. And I need to do something different because it's no longer effective. Here, that's my inner child acting up, not myself.
So what happens then if you realize I'm with a therapist and we're really not making a whole lot of progress and I want progress?
Yes. So absolutely use your voice and ask the therapist, specific questions initially. Like when you're doing your assessment with the new therapist, literally do an assessment of them as well. See what their credentials are, what they've learned, what their theoretical perspective is, what their experience is, and, go from there. If you don't do that in the initial intake, as not many people do, they just assume that they're going to be, with a therapist who's going to know what they need. If you're in there 3-4 sessions and you're like, I'm just hearing the same thing, I'm really not getting anywhere. It's okay to leave and go someplace else. I've seen people stay with therapists for years and not make any progress. And granted, some people, like we said before, are a little bit resistant to progress and they just want to have somebody, give them some validation. That's okay. If that's where they're at, that's fine. But if you're with somebody who you're wanting to experience some growth and you're not getting it, go see somebody different.
Is there a goal of I should be with a therapist for X amount of time? Is there an expectation that I should have access to a therapist for the rest of my life? Where does that kind of fall? Is there ever a time where your therapist should be like, you can't leave me, don't go anywhere? Or are they trying to graduate people off to a place of being able to be more independent?
Yeah. So with insurance would prefer people to have a treatment plan, 8 to 12 weeks, reassess, and then maybe see if they're ready to go. Insurance looks at therapy altogether differently. They want coping skills. They want behavioral changes, right, quickly so that they can, move on. Psychoanalysis, psychotherapy, inner child work, trauma work, it can take years. So it's not unusual for somebody who's really trying to unravel all these pieces in their life that don't make sense to see their therapist for years ongoing.
What happens if you have a therapist that says you're not well enough to leave me, but you feel like you're well enough to leave?
Yeah. So I would be really concerned about that. I believe that, you are the best, you're aware of what's going on inside of you. If you're getting a feeling from this therapist that they are thinking that you're more unwell than you are, and you're not seeing it on the outside world, you're functional at your job, you have good friendships, you have good, life is okay. Then I'd be like, yeah, okay, yeah, I gotta go. Right. But if it's different, because if there's a therapist, I don't think you're ready for discharge, and you are literally still heavily into your substances, have, losing your job, not handling work stress at all, conflict in relationships, you might want to consider, well, maybe I should stay. Because therapy is hard sometimes when you're doing it, when you're really getting in there. It's uncomfortable.
Mm, what are your thoughts on people jumping between different therapists, or does it ever make sense for people to see multiple therapists for different challenges that they're trying to overcome? Does it make sense to see like a substance abuse therapist while I'm seeing a marriage counselor, while I'm seeing a sex therapist? Is it possible to work with all of these people simultaneously, or is it like you just need one, or you should just focus on one thing at a time?
Yeah, that's a great question. I've had people, other therapists who aren't trauma informed, who don't know EMDR, refer their clients to me to do EMDR, once or twice a month, while they still continue to see them on a weekly basis. And as far as, the specialties of, people working with substance abuse or gambling addiction or sex therapy, I might recommend, because I'm not a specialist in any of those. If I have a client that's really exhibiting, strong unhealthy behaviors in those categories, I would definitely refer them to somebody who specializes in that. And I would stay in collaboration with that therapist and continue to keep contact with the client. So we kind of work that together.
And is that a normal thing that therapists would be collaborating with each other depending on one having a specialty in one area versus another?
Yes, it's part of our code of ethics, actually. We're not allowed to treat outside of our scope of practice. So I cannot treat somebody as a sex specialist, a sex therapist. I can do broad spectrum stuff, but if it's something that is, a severe issue that's interfering with their, well-being, I ethically need to refer them to somebody who can work specifically with that issue.
Okay. There's so much good information here right now. There's a part of me that's like wondering, am I asking all of the questions that need to be asked right now? Is there anything that you are thinking of right now that we haven't spoken about that the listeners might really appreciate hearing in regards to this topic?
Yeah, I mean, I would just say the number one take home would be do your homework and find out which type of therapist and what intervention would work best for you. Talk to a friend, do a Google search. Don't so much take the word of the person at the front desk at the facility who just assigns people to, whoever has an opening on their caseload. Really talk to somebody who knows what's being offered and what you need, just like you did with your friend.
Is there a place, is there a good place other than going to ChatGPT? That's like the first thing that just popped up in my head in regards to learning about all of these different techniques that therapists are offering.
Good question. So if you go to Psychology Today, there is a list of interventions that you can scroll through and see. And then you might Google, one at a time. They don't have the descriptions on Psych Today, but you could see which descriptions that are there and check them out and see what you come up with. But really, anybody who's gone through training that has extra, specialty like interventions on board, they're going to work well. They're going to have an enhanced education and expertise in treating mental health disorders we see most commonly.
Would you say there's any red flags to be on the lookout for if you are working with someone and maybe you're somebody who kind of like struggles to trust your intuition?
Oh, that's a really good question. So I would say if you struggle to trust your intuition, that's a great thing to work on in therapy. You need to have the right therapist for that.
But what are the red flags? What are your top three red flags?
So what I would say honestly is go look out for the really big facilities that have, the interns, the associates, the training level, facilities. Be wary of those. When you go in there to make an appointment, make sure you're set up with a therapist that specializes in what you're doing. If you don't, you're going to get thrown in with somebody who's just there to learn how to sit in front of a person. Okay. Or an associate that really doesn't have any, years of specialized training underneath their belt. Not saying that's all the time, but generally speaking, you'd want an independently licensed therapist.
Is it wrong to think you're too young, you can't help me?
Yeah, so that comes up quite a bit, and it goes back to what you're comfortable with.
Mm.
If you're not comfortable because your therapist just looks really young, you're not quite sure they have the life experience, it's okay. Therapists don't take things personally. Literally, it's okay to let that therapist know that, I think I don't feel comfortable with this fit. I'm going to go someplace else. And same thing, if you come across a therapist that just isn't, just something about them just doesn't feel quite trusting, that you can't be vulnerable and open to, that's okay too. And go someplace where you do. You really have to be with a therapist that you feel safe with in order, especially when you're doing trauma work. It's imperative.
I know you didn't say this as a red flag, but would it be a red flag if my therapist is reaching out to me outside of the professional relationship?
Yeah. So as our ACA Code of Ethics also says we are not allowed to have personal relationships with our clients outside of session in regards to, like attending birthday celebrations, pool parties, texting, things back and forth. We really have to keep a professional set of boundaries on board. And if we do anything outside of that realm, we have to have it documented and informed consent signed of letting the client know that this is, something that we both agreed upon. And there could be risks associated with that, such as somebody might notice that I've been your counselor. Yeah. But yeah, therapists really shouldn't be chit-chatting on their phone too much with their clients outside of session. It's really risky.
Would you say what's the last red flag to just be on the lookout for?
Wow. The big facilities are a red flag for me, only because I've worked at them and quite a few of them. I would say, somebody who just doesn't really seem like they care that much. And I know that's a hard thing to say, but people like to think that all, therapists were just really nurturing and warm and fuzzy and accepting and validating. And you get some people in here that are not so much that way. And they are more judgy and a little bit critical, authoritative, and condescending. And that happens too. So that would be a red flag. If you ever felt like you were being put down, your nature, your character was being criticized, I would say that would be a red flag.
I have one more question for you.
Okay.
Who should be in therapy?
Oh, I think everybody should be in therapy. Life is hard. We have so many conflicting messages out there. And we're working with a prehistoric reptilian brain that has not updated to today's world. It's overwhelmed quite often. And it's not your fault. It's just how life is these days.
So I'm assuming when you say everyone, it's not to say we all need to be in therapy all of the time, but we could all benefit spending some time in therapy just to get the support that we might need for the hard parts of life that really are just life.
Exactly. Yes. Yeah.
That's you,
well
Christy.
said.
Do you have any final thoughts before we wrap this up?
No, I don't. I just, I'm glad I had the opportunity to talk about this because I see and hear about things that's spoken, behind like therapist doors. And I just want, you as, potential clients to have this awareness that you need to find somebody who specializes in what you're looking for. Don't just walk in someplace and be placed somewhere. You're not going to get what you need.
Thank you. Thank you for listening to the Dangerous Women podcast. If you had any groundbreaking takeaways from today's episode, please tag us on social at the Dangerous Women podcast. To make sure you never miss an episode, subscribe below.